Hi, my name is Jeremy Cross. I'm an approved training provider for the Canadian Red Cross, as well as a certified first aid instructor for St.John Ambulance. Today what we're going to be looking at is adult CPR and what we can do as a first aider. So the first thing you need to be aware of is that as a first aider, your main priority is to always protect yourself. And what we do in first aid is we use what are called barrier devices. We have gloves and we have what's called a pocket mask or a face shield. And this is used to allow ventilations to go in, but prevents anything from coming in contact with the first aider. So when I arrive on the scene, the first thing I need to do is to make sure the scene is safe. Make sure that it's free from people, pets, and pathways, as a general rule. Make sure it's not like the person is not laying in a pool of water, there's no down power lines, there's nothing that will hurt or injure you as a first aider. Once that is all free and clear, you can approach your casualty. Make sure whether they are conscious or unconscious, responsive or unresponsive, you identify yourself as a first aider. You need to obtain consent before you can provide any first aid. And the way we do that is we approach our casualty and you identify yourself. Hi, my name is Jeremy. I know first aid. Sir, can you hear me? Ma'am, can you hear me? Make sure you speak into both ears. They may be hearing impaired. We don't know at this point. Sir, can you open your eyes? Ma'am, can you wiggle your fingers for me? You're getting no response. So the first thing you need to do after you've done the initial assessment for their level of consciousness is make sure you put on your gloves, if you haven't already done so. Make sure you have a barrier device as well. CPR protocols have changed so that in the event you cannot provide ventilations, straight compressions is allowed. In this scenario, we have what we need to provide ventilations in a barrier device. So we are going to ventilate as well as perform chest compressions. The first thing we need to do is we look, listen, and feel between 5 seconds and no more than 10 seconds. We're going to look down the center of the body to see if the chest is rising and falling. We're going to listen with our ear for any sounds of air escaping the body. The ear is also placed close to the mouth so that we can feel if any air is escaping as well. And what we do now is we perform what's called the head tilt and chin lift. This opens up the airway, as you can see, and you look down the center of the body, you listen and you feel. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I have no sounds, no feeling, and no visual that air is entering or exiting the body. What I need to do now is, if the person who I suspect is not breathing, I begin CPR. CPR is done at a ratio of 30 and 2. 30 compressions followed by 2 ventilations for approximately 100 compressions per minute. When you compress on the chest, you want to compress for a minimum of 2 inches in compression depth. You'll notice that the actar has a black dot indicating the center of the chest. What we do now is we place one hand with the palm on the center of the chest, arms forward, shoulders are over the casualty. We place our second hand and lock it in with the first one. We then begin 30 compressions. The key to this is to push hard and push fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Make sure you have your barrier device. It's designed to allow air to enter the body and for fluids and other things that are exiting the body not to come in contact with the first aider. Place it up around the mouth, pinch the nose, head tilt and chin lift. When you ventilate your casualty, make sure you watch for the chest to rise. Once the chest begins to rise, discontinue ventilations, allow the air to escape, provide your second ventilation, and continue with your 30 compressions. So I'm going to ventilate one time, watching for the chest to rise. Pinch the nose, tilt the head. Air escapes, ventilate a second time. Let the air escape. When you're doing your compressions, allow for the recoil as well. Make sure you allow the chest to rise before you compress the second and third, fourth, and so on and so forth. Remember, push hard and push fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Make sure your barrier device is properly secured to the casualty's face, mouth. Head tilt, chin lift, pinch the nose. Ventilate one time, watching the chest to rise. Allow the air to escape. Ventilate a second time. Allow the air to escape before you begin compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Barrier device over the mouth. Pinch the nose, head tilt, chin lift, opens up the airway. Ventilate 2 times, watching for the chest to rise. And you continue this process. You continue this process until 1, you can no longer continue, 2, medical help arrives, or 3, somebody is there to take over or aid in first aid. Once again, my name is Jeremy Cross, and this is Adult CPR.